First, I'm gonna assess the size and shape of my patient's head. I'm gonna look at her hair distribution. Next, I'm gonna examine her face for symmetry. It looks good. Then I'm gonna observe the skin of the face. Looks good. Then I'm gonna palpate the skull. And her hair is good. Now I'm gonna palpate the temporal arteries. Good. Now I'm gonna auscultate temporal arteries. Good. Good. Now I'm gonna palpate the frontal and maxillary sinus. Now I'm gonna percuss the frontal and maxillary sinus. Good. Now I'm gonna palpate the temporal mandibular joint. Can you open your mouth and close it? Good. Okay, I'm gonna ask you to do some things for me. Can you raise your eyebrows? Can you puff out your cheeks? Smile. Frown. Good. Now I'm gonna try to open your mouth. Don't let me open it. Good. Okay. Now I want you to close your eyes. And I'm gonna touch you and let me know if you feel it.
Yeah. Mm-hmm. Yes.
So now I'm gonna inspect the eyes for symmetry, distribution of eyebrows and eyelashes, and the placement of eyelids. All looks good. Can you close your eyes for me? Open them. Good. Now I'm gonna palpate the eyelids. Good. Now I'm gonna inspect your conjunctiva and sclera. Good. I'm gonna palpate the lacrimal pares. Okay. Now, can you look at the wall behind me, and then when I put my finger up close to you, look at my finger. Good. Now we're gonna do the cover and uncover test. Just look normal. Good. Good. Now I'm gonna look at your eyes, test your cornea lenses. Good. Now I'm gonna check for pupil light reflex, see if there's light in both eyes. Good. Now I'm gonna check your cornea, light reflex. Good. Now I would use the ophthalmoscope to check for red reflex. So now we're looking at your ears. I'm gonna inspect and palpate your ears. Good. Good. Now I'm gonna palpate the mastoid process. Good. Then I would use the otoscope to inspect your ear canals and look at your tympanic membrane. I pull out and up, and your tympanic membrane looks gray, which it should. Now I'm gonna perform the whisper test. I'm gonna whisper, and I want you to say what I said.
Dog. Cat. Coffee. Computer.
Good. Now we're gonna do the Weber test. Let me know if you can hear the sound in both ears. Okay. Now we're gonna do the Ryan test behind your ears. Let me know if you can hear it and feel the vibration. Okay. Then I would do the other ear. Inspect the nose and mouth. I'm gonna inspect and palpate your nose. It's good. I'm gonna check for alignment. That looks good too. I'm gonna check if your septums are in line. Good. I'm gonna, my pen light, I'm gonna check your nasal mucosa. Check the patency. Looks good. Can you close your eyes for me? Let me know. I'm gonna put something up to your nose and let me know what it is by smelling.
Coughing.
Yep. And I'm gonna inspect your mouth, lips, gums and teeth. Can you open your mouth? Looks good. Now I'm gonna check your tongue and your throat, your tonsils. Good. Can you stick your tongue out? Move side to side. I'm gonna put pressure on your tongue and then try to move it that way. Good. Other way. Good. Now I'm gonna check your gag reflex. Can you open your mouth? Good. Now can you close your eyes? Let me know what this is. Open your mouth.
Salt.
Good. And I would also palpate the floor of your mouth when I was looking at it. Go. Now I'm gonna inspect your neck. Now, can you move your neck around for me? Good. Can you shrug your shoulders? Can you do it again? Can you move your face this way? Good. Other way. Good. Now I'm going to assess your jugular vein, see if there's any bulging. Good. Good. I'm gonna assess your lymph nodes, the posterior article, the occipital, the tonsillar, submandibular, submental, superficial cervical, deep cervical chain, and posterior cervical and supraclavicular. Good. Now I'm going to assess your trachea and thyroid gland. Looks good. Now, palpate your thyroid gland. Can you swallow for me? Okay. Now I'm gonna auscultate your thyroid gland. Good. Palpate your carotid arteries. Oh, you just do one because you do two, they might pass out. And now I'm gonna auscultate the carotid arteries. Good. Now we're going to do respiratory. I'm going to inspect your thorax, see if you're having problems breathing. Now, can you take a deep breath for me? Good. Can you say 99?
99.
Say it again.
99. 99.
Good. I'm going to palpate your posterior thorax. Good. Now I'm going to percuss. Now I'm going to listen. Can you take a deep breath? Good. 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 One more time. Good. Now I'm going to palpate your kidneys. Good. I'm going to inspect your anterior. Looks good. I'm going to palpate your inferior. Good. Now I'm going to percuss. Good. to listen to your lungs. Can you take a deep breath? Good. 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 One more time. Good. We're gonna do cardiac. I'm gonna inspect your chest and inspect and palpate your apical pulse. Good. Now with the ball of my hand, I'm gonna palpate all your valves, your aortic, pulmonic, Erb's points, tricuspid, and mitral. Good. Now I'm gonna listen over those 5 spots. Sounds good. If I would have heard a murmur, S3 or S4 sound, I would listen with the bell side of my stethoscope. And if I would have heard it, I would also have her lay down or lie in Sims position. Now we're moving on to abdomen. I'm gonna inspect the abdomen. Looks good. I'm gonna take a listen, starting with her right lower quadrant. Good. Now I'm gonna listen for the aorta, renal, iliac arteries with the bell of my stethoscope. Good. Now I'm gonna percuss the abdomen. Now I'm gonna palpate, first with light palpation. Do you have any pain? Now deeper. Now I'm gonna palpate the liver, the spleen, and the kidneys. Now I would do the other side. Now, can I have you sit up? I'm gonna check for rebound tenderness. Does it hurt?
No.
Go. Now, we're gonna do the musculoskeletal and the neurological. I'm gonna inspect your overall appearance, inspect your hands and fingers, observe for a capillary refill in both hands. Looks good. Now I'm gonna assess for clubbing. Can you put your hands like this so I can see your nails? Good. Now I'm gonna palpate your radial pulse. Good. And your brachial. Good. Now we're gonna do the Allen test. Can you open and close your hands? That's good. Open it. When I let go, all the blood should pool back. Good. Now I'm gonna palpate your epitrochlear lymph nodes, which is in between your bicep and tricep muscle. Then I do the other side. Then I'll palpate the axillary lymph node. Good. Other side. Good. Can you move your arms for me? Good. Now can you stick your arm out? Try to go up. Other hand. Good. Now can you pull your sleeve up? We're gonna assess sharp and dull sensation. So this is dull, this is sharp. Can you close your eyes? And lift this thing up here. Good. Now can you close your eyes for me? Can you stick your hand out? Can you tell me what this is? Without looking at it. Yep. What kind of coin?
Oh, a nickel.
Good job. Can you give me your palm? I'm gonna write a number on your hand, and then you let me know what number I wrote.
8.
Yep. Now can you stand up for me? Can you do the sobriety walk, heel to toe? Good. Now I'll turn around. Heel, just walk on your heels. And now walk on your toes. Good. Come back. Now we're gonna perform the Romberg test. Can you close your eyes, hands to sides? Gonna push you a little bit. Good. You can sit back down. Now I'm gonna, can you go like this? Good. Then let's do the finger to nose test. Close your, go like, no, open your eyes and touch your nose. And now do it with your eyes closed. Good. Now we're gonna assess your bicep, tricep, and brachial reflex. Good. 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 Now, I'm gonna inspect your legs, even hair distribution. I'm gonna palpate your skin and joints of legs. Now I'm gonna palpate your femoral arteries. Good. Your popliteal arteries. Your posterior tibial. And your feetals. And then the other leg. Now, I'm gonna make this sound and you're gonna let me know if you feel a vibration on your knee.
Yep.
Okay, other knee.
Yep.
Good. Can you move your legs for me? Good. Can you split it up? Other one. That's good. Now, I'm gonna do the same thing that I did with your arms, dull and sharp, and you let me know what it is. Close your eyes.
Dull, sharp. Dull, sharp.
Good job. Now, I want you to close your eyes and I'm gonna touch your body appropriately and let me know if you feel it.
Yep.
Can you let me know what I'm touching?
Well, first one was my forehead, that's my knee. My foot. My hand. My elbow.
Good job. Now I'm gonna assess for kinesthesia. It's the position of your great toe. I'm just gonna move it up and down. Good. Now I'm gonna assess your patellar, Achilles, tender, and plantar reflex. So your knee. Good. Good. And I do the other leg.